Well, as you know, we live in an era of makeover shows that transform people's looks through cosmetic surgery. But for many, the effects are a bit too extreme. In tonight's Medical Journal, ABC 7's Dr. Dina Dell has a story of one woman who's doing it a little bit at a time.
Sarah received a facelift, an upper and lower.
The popularity of programs like Extreme Makeover demonstrates Americans are hooked on real-life fairy tales in which ugly ducklings become beautiful swans. But most women don't need a full makeover. They need a little tweaking.
We touch up our cars, our houses, the interiors, so why not do a little bit of a touch-up to your body or your face or whatever you feel needs to be done. This section right here is what we're going to be removing.
Exactly a year ago, we tagged along when Sharon first sought help for her drooping chin.
That's done through a small little incision under here.
San Francisco plastic surgeon Randall Weil removed fat through 3 small incision points, and a few days later, you could see a big improvement. 1 year later, makeup is not quite doing the trick, so Sharon has decided she's ready to do more. Recent studies show that she is typical of a new breed of patient who doesn't want to wait for the full facelift. She wants to reverse aging a few mini procedures at a time, starting with her eyes.
The way I feel when I look in the mirror, my eyes, it gives it a very tired look and a stern look also.
The incision's going to be right under the lash.
Dr. Weil carefully marks the skin he'll be removing and tightening.
So you can take out the fat bags on the lower lids and take off some of the skin on the upper lids to open up the eye.
The procedure is done under a local anesthetic and takes less than an hour. And while she's at it, Sharon decided to include a chin implant to balance out her profile. The surgery should result in little or no scarring and minimal downtime.
These are the things that people like to do such that over a period of time they continue to look great.
The one for the upper eyelids was brought from the corner of the eye and kind of comes out a little bit.
And 2 weeks later, Sharon is delighted with the difference.
I've been told that I'm about 15 years younger looking than before I had the surgeries, and that's actually 5 years more than I was looking for. So I feel great. Smiling.
From where Sharon started, a few mini procedures have added up to maximum results. I'm Dr. Dina Dell.
Now, you should know the recovery time for those mini procedures is usually just a day or two compared to a week or even more, much more for a full facelift. To learn more about them, go to our website, abc7news.com, and click on Dr. Dina.